have somebody who is competent enough to do justice to the topic. He's a renowned personality. Dr. Lateef Akinola graduated from University of Ibadan in 1985 with MBBS. Since then, he had trained in Nigeria and abroad to earn MSc in Human Anatomy, Embryology, University of Lagos, PhD, Molecular Reproductive Endocrinology, University of Oulu, Finland, where through his research, he clothed the gene responsible for estrogen metabolism in human and research animals. He's a fellow of the Royal College of Obstetricians and Gynaecologists, England, and fellow of Royal College of Obstetricians and Gynaecology. He also got an MBA Health Services Management from the University of Plymouth, England, to sharpen his health services management skills. Dr. Lateef Akinola is a distinguished obstetrician and gynecologist, reproductive medicine specialist, is a tutor of tutors, and an undergraduate postgraduate teacher in various hospitals, home and abroad. He is an adjunct associate senior lecturer and seasoned senior research fellow at Department of Obstetrician and Gynecology College of Medicine, University of Lagos, where and is senior research fellow at the Center for Clinical Trials, Research and Implementation Services, University of Lagos, Nigeria. He trained in the London Deanery and he has worked as a trainee and consultant at St. Bartholomew's Assistant Perception Unit, Royal London Hospital, Newham University, Women's Clinic. While working in these hospitals, we gained advanced specialist interest in obstetrics, gynecology, minimal antech surgery, laparoscopy, and hysteroscopy, and fertility medicine. He has a keen interest in molecular biomedical research, especially in ovarian pseudogenesis and polypogenesis, as pertains to assisted reproductive technology. His clinical research interests also encompasses endometriosis, adenomyosis, FRCOG, recurrent miscarriages, fertility optimization, polycystic ovarian syndrome, high risk obstetrics. He has published extensively clinical research in interest in high impact journals. He is happily married with children. He presently practices in Lagos as a consultant obstetrician and gynecologist, reproductive medicine and RDS specialist at the medicine specialist Women's Hospital, Lekki. He is a member of the Executive Council and the Editor-in-Chief of SUCON, Legal Sector, and AFRH. He is also a member of the British Pastor Society, European Society for Human Reproduction and Embryology, and the American Society for Reproductive Medicine. Sirs, distinguished audience, I'd like to present to her Dr. Lateef Akinola. Thank you very much, sir.
I'm very grateful for your kind invitation forming in this pop-up lecture. I have not appeared this sort of lecture in Lagos, at least in two institutions. At the conference of Air so at Lagos Gates, that's the truth. But this one is an extended one because you include medical research at least. To mention distinguished guests that we have this lecture to Ugora, Professor Lateef, and Professor Yuade. I want to thank you all for being here, to take the time for the activities up here to listen to this lecture. Thank you so much for the invitation. And I also want to thank you, residents, medical students, and all the other consultants that are present today. If you have any questions, do please stop me at any point and try to get clarification to that will push operate. So my agenda today is on artificial intelligence, its relevance in healthcare and medical research. We are going to start with, I will introduce artificial intelligence in medicine. What is the scope? What are the indications? What are the usefulness of artificial intelligence? And then, of course, we'll talk about AI itself, the type of models that are available out there that can be used in medicine and any other human endeavors. AI advances in healthcare and medical research will point to that as well. And then we'll have an overview of assisted reproductive technology, the influence of artificial intelligence in IVF, ICSI, and ART itself. So we'll talk about the ethical landmines, legal implications, and practical considerations of artificial intelligence. Nothing in human life that has an advantage also has a disadvantage. There are pros and cons of everything that or anything that is related to human endeavor. So we also mentioned something about the future perspectives and innovation, especially that is relevant to us in Nigeria and Africa in general. Healthcare systems, as we operate now, is unsustainable in terms of human intelligence and cognizance. So there are some strains in the current or contemporary health systems around the world, not only in Africa, but also worldwide. We have delay in disease detection. We all know what happened during COVID-19. Not until a significant number of people have died before we recognize, what is going on? And everybody started rushing to take cover. There are suboptimal treatments. We are all in the medical profession, so I'm sure we know what suboptimal treatments are, and not especially in Nigeria now. It's not working. Look. In Nigeria now, where we have our patients very educated now, internet is there, artificial intelligence is there. Some of them, the ones that are quite learned, they get all their information from the internet, and they come to your room for consultation. They, set you a barrage of questions, and behold, nobody is completely perfect. If there's any mistake, the lawyers are there waiting for us. So we know what suboptimal treatments are. Resources are, we have resource shortages. Resource shortages everywhere, even in America. There is nobody that is contented with all the resources they have. Inadequate professional capacity and capability. We know the effect of JAPA on our healthcare system in Nigeria. A number of us that remains in Nigeria now, we have a lot of fatigue, medical burnouts, and of course, this could lead to errors that could be fatal. Escalating cost is there, system disparities is there. Now we are looking at something else that can help us to mitigate all these challenges we have in the current healthcare system that manage all the world, throughout the world. Is artificial intelligence to the rescue? How do we scale artificial intelligence? As for a global health outcome and medical research, so that we can benefit completely from its usefulness. Now, we all know that currently a lot of money has been spent on artificial intelligence, making it relevant to human needs. Up to $180 to $200 billion has been spent in research, and to give us the current thing we have now, ChatGPT 5, and OpenAI, Google, Gemini, all the artificial intelligence models that are available now. And in the United States, out of this up to $200 billion that is expected to be spent by 2030, they're expected to spend 80% of this amount, in research, because they project that this is going to be the in thing for the future. Everything that we are doing now, everything in human capacity or capability might be taken, will be almost completely taken over by artificial intelligence. I'm sure we know a lot about artificial intelligence. The fear that artificial intelligence is going to take up all our work, even we send doctors back home. So we have robotic doctors, robotic consultants everywhere. So artificial intelligence has given us over the years, over the research that's been done, at least 90 to 95% sensitivity and specificity in all the researches, and all the models that are using are working perfectly. So there is that need. Maybe in future, all the clerical jobs, human resources will be taken over by artificial intelligence. Even us medical doctors, we are not safe. More than 60% of at least one AI tool is being used in all the departments of medical knowledge. You talk about radiology, talk about cardiology, talk about obs and gynae, talk about IDF, and of course, automation. Robotic automation is coming in, especially in our surgical rooms and in IVF laboratories, growing at least about 35% yearly. There's incremental growth in the reach of artificial intelligence. And by this data is even something from 2020, and then God knows, maybe it's going to be much more than this or double this percentage by the time it's analyzed this time around. As I said earlier on, global investment in artificial intelligence is overwhelming and has taken over all technological investments. And in fact, this has driven recently the fear that, people are putting too much money here. Maybe one day there's going to be a problem, catastrophic loss for all their investments. Will they be able to recover these investments? And this has given us at least hope. OpenAI Foundation, has given us hope that, through the research they are carrying out and implementation of their research work, they are actually delivering. So that fear is being doused now, and we don't have, there's restrictions to spend, and they are still spending. So a cursory look at PubMed, how many artificial intelligence in healthcare publications are abound. I found a few days ago, over 35,000 publications. And I don't know, even by today, if I search, maybe this will have gone up. So it's telling us that a lot of money, a lot of R&D, a lot of scientist dedication is going on to improve the reach of artificial intelligence in human endeavor. Not left out is life sciences. What is artificial intelligence? I'm sure we all know that. We've Googled it, we've seen it. Artificial intelligence are computer complexes and machine technologies that are made to simulate human learning, comprehension, problem solving, decision making. It can simulate human activity or creativity, and are often autonomic. That's why we have robots. And as I'm talking now, there are some researchers working on artificial intelligence robots to take over our activities as surgeons, gynecologists, whatever in our theater. So in future, the robotic system we have now, surgical assisted robots we have now, are operated by humans, but possibly in the next few years, maybe up to 5 years now, we'll have a completely independent robot that will be doing surgeries. Artificial intelligence is one of ambition, setbacks, and reinvention. Over the years, from ancient to 19th century, people have been working on computer systems, computer complexes, Aristotle, using logic to explain human reasoning, to find out how does human reason out. How do they reason? Can we simulate this with our current machine? But the downfall of their activities are because, as we know, R&D in computer science at that time is very, very rudimentary. So they don't have that capacity, computer capacity, to be able to do what we are doing now with artificial intelligence. You need very, very powerful computers, extremely powerful computers with extremely high random access memory, extreme data to store all your activities. So all these things were lacking in the 19th century, 20th century, and of course in early 70s. But a breakthrough came in 20th century. Alan Turing, a Briton, made the first computer desktop, and that gave expression to what the kind of logic job Aristotle has done. They can now use computer logic to simulate human reasoning. But this also was still very rudimentary. In the early 50s and 70s, a number of computer complexes in medical research were built, and they were working very fine. But they met a brick wall because they still don't have that computer capacity to be able to match up to human intelligence and cognizance. So they all gave up. And that's why we call AI winters, that everybody gave up. We can't work on this because we cannot manufacture such very high-powered computer complexes that can simulate human intelligence. But in the year 1980, gave rise to a number of scientists, very eminent, intelligent scientists came out with IBM's Deep Blue, when a computer system played chess with Garry Kasparov, the world champion, and that computer system was at least managed to beat Kasparov. And then from that one, the synergy, computer complexes, random access memories, data capabilities available. So they were able to leapfrog to where we are today. And as of today, we have deep learning, big data. You can imagine, even in this Olabisi Onabanjo Teaching Hospital, we see a lot of patients. How many patients' data we generate from O&G, surgery, accident and emergency? This is clearly beyond one human comprehension. So you need a powerful computer that can collect all this data from A&E, from surgical department, Obs and Gynae, psychiatry, and could look at this data, analyze it in the cloud, and tell us what are the usefulness of this data. The computer system are able to take out data, relevant data, and tell us, look, all this data all these computer complex that you have, they all have data, 1 terabyte, 2 terabytes, or more. But these are the relevant data I can get from here. And these are the ones I analyze, and these are my findings. So we don't have to bother ourselves. Computer system can do it for us. From the year 2000 to 2010, modern applications of AI take a number of importance in medicine and medical research. What are the benefits of artificial intelligence in the health industry? Of course, using artificial intelligence, these are not subhumans. They are actually machines, and they are practically computer complexes. You see a robot now working on the internet. It's computer that is making it. It's a program, algorithm, computer that is making it. So it will enhance our patient's care. You go to China now, from the airports, You don't need to go to any hospital. During the problem we have with COVID, pandemic, you don't need to go to any hospitals. You just step out from the airport, go enter a kiosk or cubicle. There is a machine there. You just stay. We'll measure your temperature, your blood pressure. You don't need to do anything. All your data will be there for the custom people to analyze. So you don't need you don't need a nurse to come and take your blood pressure. The machine will do it. So it will enhance patients' care. So that helps them to triage people. Those who are suspected to have infection, those who are normal, you can go suspected, then they track them for further investigations. So it can also offer us accurate information, precise information, not guesswork. So that is one of the importance, very big importance or advantage of artificial intelligence. It can improve our healthcare experience. As doctors, we work 24 hours, almost 24 hours a day, especially if you're on call. With artificial intelligence, you don't need to go to hospital all the time. You can, at least in hospitals that have electronic medical records, you can be at home. In my hospital now, I can just log in and see how many number of patients we have, what are their clinical conditions, their vital signs. I can check them from here. So that is the work of artificial intelligence. It saves off a lot of time. We will see examples of all this. It reduced care cost because let's take, for example, in China, you go to the kiosk cubicle, it measures everything for you. It saves you a lot of time. You don't have to go to their accident and emergency. You don't have to go to their hospital. All you want to do, you've done in 5 minutes. Then if you are okay, you are going on your way. It also makes us to give better decision in terms of managing our patients. Data analysis and improved diagnosis is also something that is worked out very well. There are different types of artificial intelligence models. Model that is good for medical science, model that is good for research, model that is good for HR, EMR, or whatever human endeavor you want to think about. There are machine learning models, and there are supervised, unsupervised. This, all it means is that if you want to have an artificial intelligence, say software that you can install in your computer. So you train your computer complexes. You feed your computer complexes with a lot of data. Like, let's say, for example, I want to do something in surgery. I want to do something that would triage my patients for me in surgery. Then I get all the articles, published articles from PubMed. I feed all those articles into my computer. My computer complex will now analyze all these articles. And if I ask any question, oh, I have these patients, these are the symptoms. And then I feed it into we've all used ChatGPT. You ask questions, it goes into the computer complexes, and it brings answer to you. Oh, my patients, A, B, C, D. Symptoms 1, 2, 3, 4. What's diagnosis and management profile? Artificial intelligence will give it all down to you. But as of this moment, we need to be very careful. Don't rely on artificial intelligence all the time, because it can also make mistakes, like, most of us humans. So there are supervised, unsupervised, semi-supervised, and reinforced learning system. So you feed the data into your computer complex, and it's going to come out with the product software for you. Deep learning models, there are neural networks, feed-forward, convolutional. Don't worry about that. Just be comfortable with the usage of the software. There are generative AI models, and this can create new contents. These generative AI models, if you can use it to, this is what is used in ChatGPT, and that's why they said some authors, publishers, will go to the artificial intelligence and then let the artificial intelligence write their research work for them and submit as their work. So they use generative AI models. Agentic models, these are autonomous systems that can plan, reason, respond, and that's what we use in AMR, laboratory automations. We'll see examples as we go along. Hybrid models, multimodal models. This one, you just need to feed the computer complex with text, images, neural data, and it's going to give you, like if you are doing a scan machine that is leveraged with artificial intelligence, it's going to be much more better, faster, giving you much more resolute images compared to ultrasound scan without artificial intelligence. Artificial intelligence is everywhere, not only in medical sciences, not only in medical research. Artificial intelligence is in hospitals, schools, smart homes, banking and finance, entertainment, autonomous cars, traveling, fake news, social media, e-commerce, anything, any human endeavor. And that's why there is a lot of scare that, look, artificial intelligence will take over all our jobs in the near future. So, what is the scope of artificial intelligence? Now, you can imagine from the 19th century when Aristotle started at logic, building computer complexes that can reason, till now. Now we have a lot of data, mega data, that even us human, our brain doesn't have the full capacity to analyze those data. So you can see this tells us a lot of data tangled together. With artificial intelligence, we can break this data into analyzable ones that are good for us. We are actually at a crossroad now because rapidly expanding data system that we have, we don't have that cognitive power to process it. So we are solely relying on machines to process those data for us. Of course, the complexity and volume of the contemporary medical data is also very significant. And we need a subset of artificial intelligence machine to analyze those data for us. And in fact, there are some machines now. You don't need to do stereoscopy. Actually, 3D, 4D, 5D scans to see all that is in the endometrial cavity without you taking the patient to the theater. So those are the benefits and relevant compatibilities. Embryo selection difficulties and very basic. They still have problems with big genetic tests. The reason why a lot of histologies in over 40s, like 3, 41, 3 or above, they are not getting pregnant is because quality of the SRT are not as good as when you are 30, you are now. So, with artificial intelligence, we will be able to select out of all the eggs, those ones that are out of all the those ones that are so that we can concentrate on using most valuable ones. So we have examples, advancing embryo grading and pregnancy prediction with AI. So here are publications like that. Here are full embryology lab. Key success post in ICANN is the embryology lab. It's where they make the embryos. Embryologists work very verified in blood lab. Success rate, pregnancy rate 0. But if you have a very good one, it can be reached up to 85%. And that's what artificial intelligence. They have a quick automated machine. You don't need human in the embryology lab. Complete automated machine, all you need, feed the machine with a sperm, feed the machine with research you collect. The machine will get you the embryo, put them in the incubator frame, and it can take samples for you. Eliminate complete human connection. And they have this, first baby has been born. Using brief IVF going to the pollution without any human intervention. Just the machine. This is the scan machine by taking. There's a video I'm trying to get you. You can see very clearly. I can send. he drinking drink food and download the video. We see massive work and a lot of successes have been done through that. Or we all do this history of the young man now to our cleaner product. Coskai care baby born in the Oldham, UK. He might be for 8. She has that 2 babies now. They are not right there. So that tells us baby born the type there, they are modest, no more than natural conception. She has 2 babies now, not like the number of babies, one out here, they have babies. We have our own heroes as well, in the persons of, as people were inside. I was in exam yesterday. They were celebrating 79th birthday. His person here. So they made the first IVF baby in Nigeria in 1986 and founded in 1992 Nigerian Fertility Society, which is now AIR Courage, Association of AIR Courage, 20 event, and the pioneers that we are looking up to now. And of course, since 1978, when we have Rich Brown, up to 50 million babies got worldwide. And in Nigeria, more than 10,000 babies is an underestimate. It should be more than that. So, but through artificial intelligence, AI-driven sperm analysis, as I showed earlier on, we can improve our sperm analysis. The problem with sperm is you can look under the microscope. You see all the places. You don't know which one is completely normal. Or with artificial intelligence, I'm practicing in my lab now as a company consultant. They are working with so that we can use artificial intelligence instead of using embryologists to select the sperm that we may use to fact it, which is going up very well. They've been doing improving in the US, South Korea, Asia. Why can't we use it in Nigeria as well? So we are piloting it, and it's working very well. But what the machine artificial intelligence doing for us, put the sperm sample on slide under the microscope. You are complex. Tuning so AI software going to select for tell us is sperm without any DNA fragmentation, without any DNA chromosomal breakage, and any DNA that is analyzed that less than 15% tell us that's the best one. Anyone that more than 30%, even if it's running, authority is over 100%, we use. So artificial intelligence can help us to streamline abnormal from abnormal sperm. And of course, we know now when it has 10, 20 years, when a man doesn't have the sperm, that is the end of the story. But right now, with artificial intelligence, we can use AI, the machine we're piloting now. If somebody's got no sperm at all, we can use artificial intelligence to fish up a normal sperm that we can use for us, where human analysis has failed. See this couple, 19 years of outbreak, 15 failed ideas attempts. One AI tool make it happen. This man that no sperm in the senior son for years, but the AI, artificial intelligence, was able to get sperm, see all this great. Look, human, we did, but AI embedded machines saw it and they used it and they were very happy for it. We use AI in our embryology laboratory as well for embryo selection, which are great. And we are now in state of automation, laboratory automation that are referred earlier. That completely, push aside the biologists in the lab. This is the machine I was talking to you about. This machine, automatic. It's completely autonomous, and it will do the job of embryologist for you. These are what the embryologists can see. Everybody very scared that look at build with the next couple of years or at least in the next 5 years. It's coming there, it's probably going to be about. So now let's look at investment in agriculture around all. USA take the lead, 80% of worldwide ambition out of the billions of dollars that we spend. 80% of it are spent in US. China coming after the US, EU, Asia. Africa, we're still at very early stage, but it's small, but it's fast growing. So we should be very hopeful. Next few years will also do that. Adoption and market landscape for AI healthcare, global and Africa. As I mentioned, Africa, we are coming, we are still not there because we still have a lot of other population problems, but I think we don't have that luxury of dollars to spend. But we are there, we are going to be there in the next few years. So, in clinical performance in AIs in Africa, you can see that even in Africa, radiology, ophthalmology, obstetrics, infectious diseases, pathology, all have been benefiting significantly with AI and embedded machine. Radiology, tested spray, TB detection, diabetes, ophthalmology, obstetric, preeclampsia screening, risk prediction. AI is very excellent in that. Infectious diseases, outbreak prediction, pandemic prediction. AI can predict for us pandemic in the next 1, 2, or 3 years. So we will get ready for it. And of course, digital slide analysis and microscope now, they are of bigger picture. You can analyze, see pictures better than me. Efficiencies, very dynamic, and it's been very artful in terms of gains, health system domain, what are the clinical documentation, imaging, bed theater management, medicine supply chains, or meeting T-health. These are primary health system. Artificial intelligence is very robust, and it's going to come in very well. It's being piloted in Lagos now. All the primary health system, they are trying to see what artificial intelligence can leverage because of the that party. In Nigeria, we are not paying cheap value. Apart from the cost of the machines of artificial intelligence facilities, where they are very expensive. Like in my lab now, where to analyze intelligence software, to analyze it, per spam analysis is paying $25. So it's coming. Hopefully, the cost is going to come down with China coming into the market. There are a lot of benefits from the intelligence application, but there are ethical line, and job security is also very well. Yes. So we see now. This is the picture that is I got on the internet and I sent to my social media impacts. Everybody was very happy. You see, this is the patient, this is the doctor. That's why we look very careful with jelly. He has achieved good results. Or it can also be like this doctor is telling this patient, okay, there is your diagnosis. Alexa, which is Google, artificial intelligence machine, says you have malaria. Siri, Apple, concluded you have worms, and ChatGPT indicated that it's rocky fever mountain. So you can see now, you just look at that it gives you malaria. Siri, it gives you worms. Then you use ChatGPT. It says these patients have got some mountain fever, malaria, rocky mountain. So you can see now the problem we have. So even though we have intelligence from Google, from Meta, Microsoft, there is still problem of operability. So, and as I said earlier, It's a primary data you feed your computer complexly. By feeding my cognac, select malaria for me. And I'm now feeding it to diagnose the delicious TB rubbish. Still, this that give us human confidence that yes, even the artificial intelligence is coming to take up some jobs, but human overview is still very paramount. This patient now, if I rely only on Alexa, I will just give anti-malaria, and the patient will not only. So, blood check we have some drawbacks in and health science. Data privacy concerns very important. If you feed my data, that's why even in my lab where I need that noise data, it's called the PD cache. It's a remind, so try to get actual comments. We get spam, see all the images of nice spam and compare with our own image. I say yes, this one looks like the best one there, so you can use this one. That data is in office cloud. So if I put my patient's name, privacy is going to be broken. So data privacy is still of significant importance. Algorithm bias, some people can feed their data, only European data, and then I want to use it in Africa, Silico, because and PPD. The racial and ethnic background is also very, also their lack of transparency. I don't know whether what they are trying to say is even because I'm just putting my data into a machine. I don't know what the machine is. So there's no transparency. Then we come in time where we'll be so much reliant on technology. This happening now. There's nobody that do it without a mobile phone, at least in this modern age. Natural implications very costly, ethical dilemmas, patient's trust and acceptance. If you use artificial intelligence to analyze patients' sample, patient may not believe it. So what do you mean that your machine is your? So there are growing ethical questions. The most important point is that if you are going to use artificial intelligence on a patient's data, get the patient's consent. Then look, if they can analyze it by AI and I feel is very correct before you start this application. Regulatory data concerns are there. Everybody is using artificial intelligence. There is no data governance. It's just published. There's nobody trying to verify. Software from Meta is the best, or as false. Should they be using it? They are just bringing it from RIE straight consumer for consumer consumption. So we don't have total confidence because there's no governance. FDA in America would have dropped organizations in America. They are doing their best, but still there's a lack of significance there as well. Data privacy, as I mentioned earlier, and then of course, I told you, I sit in my lab, I put the sample of the computer, microscopic computer, and then it takes it to the computer complex, give me my diagnosis here. I don't know what is going on in this black box. How is the AI machine analyzing my data? I don't. But people are now asking questions. Look, I want to put my data here, or I want to follow my data. So give me a glass box instead of this black box. I want to see how my data is going to go through your machine, what your machine is doing with my data to give me this data. So this, hopefully in future, will bring more confidence in what AI. It's like we are doing it surgery, we are doing, let's say, stereoscopy. The patient goes out. Patient is awake, seeing all what you are doing there. So it's very, very important that we monitor transparency with the machines we are needing. The benefits and limitations of AI, we have mentioned it. Limitations are bound as well. We talk about data privacy and transparency and all the likes that we mentioned earlier. the future of human personalized medicine. With artificial intelligence, we can unravel the gauging intelligence, digital human anatomy, therapeutics, drugs R&D trials, genetic mutations. So if a person is coming to the hospital for consultation, within a single sweep, you can do rather than the person going to the geriatric department, anatomy department, pathology department, diabetes. Person can just pick a sample that you can analyze and get all the information, and then including genetic information, then you can be able to personalize your prescription for that patient. So thank you for listening. The future of AI is coming. There's no need for us to be afraid to use it, or we just need to make up, make sure we don't work at chat software that one data it's been fed with. Thank you so much for listening. Thank you for the invitation.